Health services will be disrupted from midnight in Nairobi County as medical workers down their tools, even as the county and country deals with the COVID-19 pandemic. Daylong crisis talks between the Kenya Medical Practitioners and Dentists Union Nairobi chapter and the Nairobi Metropolitan Services NMS flopped, ushering the city-county in the list of counties whose health workers have gone on strike. Delayed salaries, unpaid special allowances, and inadequate protective kits top in the frontline workers' grievances. Here's Francis Kashuri with more.
After hours of haggling between the Doctors' Union top brass and the leadership of Nairobi Metropolitan Services NMS, a medical crisis looms in the country's capital city.
We've just concluded the meeting and there is no deal.
The failed talks ushering in a doctor strike from midnight as Nairobi County leads in number of confirmed COVID-19 cases in the country. Their grievances include delayed salaries, unfulfilled promises of special allowances for the frontline workers, and inadequate or substandard protective kits for the medics.
Enough. Enough of everything. Enough of doctors trying their best, putting themselves out in danger to protect others, and they're not protected. We also need to be protected.
The crisis is likely to spread countrywide by mid-next month after the Kenya National Union of Clinical Officers, Kenya Union of Nurses and Medical Laboratories Technicians issued a 21-day strike notice.
It is a time when we have a ministry that has received numerous contribution, donation, and even funding from the government. But nothing is reflecting on the ground.
Mgomo utakuwa country mzima na utashika pia Kenyatta National Hospital, Moi Teaching and Referral Hospital na pia Kenyatta University Teaching and Referral Hospital.
Medical workers in Homa Bay County have already downed their tools after 10 months of no pay. Their counterparts in Tana River County have exited medical facilities after 3 months of delayed pay. But the medical workers will have to wait for the special allowances announced by President Uhuru Kenyatta, ostensibly to motivate COVID-19 pandemic frontline workers. Health Principal Secretary Susan Mochache told Parliament that lack of structures and legal framework had hampered disbursement of the 3.4 billion shillings that was to cushion health workers. According to the Afya House document, the 3.4 billion shillings allocation in the supplementary estimates number 3 of 2019-2020 was to finance emergency allowances and benefits for frontline medical workers for 3 months, April, May and June. 520 million shillings was to be used in providing medical cover for 15,000 health workers in 22 counties that did not have any other medical scheme, while 20 million shillings was to fund psychosocial support for medical personnel. The millions, however, could not be utilized due to what the ministry terms lack of a framework for the insurance and psychosocial support. The health PS claiming there was insufficient time to establish the framework since the funds were received at the tail end of the financial year 2019-2020. The ministry is asking for the money to be revoted in the current financial year 2020-2021 through a supplementary budget. According to a circular from the Salaries and Remuneration Commission SRC, dated 28 April 2020, medical doctors, dentists and pharmacists were to receive 20,000 shillings each in special allowances, while clinical officers, nurses, medical lab technologists and technicians were to pocket 15,000 shillings monthly in COVID-19 allowances. The third category of medical workers, that includes community health workers, medical social workers, public health workers, radiographers, drivers and mortuary attendants, were to earn 10,000 shillings monthly in special allowances, while the last cadre, that includes cleaning supervisors, support staff and boiler assistants, were to get 5,000 shillings in COVID-19 allowances. Francis Gashuri, Citizen TV.